present by the Permanent Secretary, Minister of Health, the Regional Director of North Bank East, Mr. Jaju and staffs, the security apparatus here present, headed by the 2nd Infantry Battalion, Farafenye, members of the community, students and their teachers from the Mauritania Primary School, our Kanyelengs, the U.S. Ambassador and her office here in Farafenye. We all welcome you to Farafenye North Bank region. This very important day here in the history of our health facilities in the North Bank region and of course across the country. We understand that 22 health facilities have already benefited the hand-washing stations, and today we gathered here to officially hand over these facilities to the Regional Health Directorate in the North Bank region, and of course by extension all the 8 peripheral health facilities across North Bank East. Without much ado, I will call on the Kanyelengs from Sabah to inform us what we are going to have today in our local language, please. Badi ngolungal ko yole je Sirinjang anim fana USAID melialon ko ifana lu jamale na takabone la bundal la UNICEF fana la infa bal bijang enila do ku nyolu melno na ta jang bi anim fana water resources fana la infa bijang ne ngamonu jang na tanko bunda molu bijanne na badi musolu melno be jama kono jang anim fana kal ba mum be Farafenye rita sefo alaji Sambu Jang ening nga director fana ji jambe be VOH na tanko bunda molu fana bijam men be 2nd Infantry Battalion Farafenye andum fana America la ambassador ba aninga do ku nyolu finalement be tan lumotolo bi so ngaje ko bi mudum kuma balti na nyintundo la jang bari mbe ngalon ne ko senia anin jata kende atata nyolale o kamala ngaje ko ye buluku dula dada jang men yalon ko molu nyante buluku la woleto membe be senia la kono andu senia mu jata kende aldi ko nga fa nyame bokk yi su ko defee nag ñu nuyu leen di leen bismillah fii ci Farafenye di leen won ne li nga xam ne moo tax ñu dajee fii tey muy bés bu màgg boo xam ne dañuy màggale liggéey bu rafet bi nga xam ne moom lañ def fii nii ak yeneenu bunt yi nga xam ne ñoo nekk ci wàllu wér-gu-yaram ci suñ tund ji fii nii nga xam ne liñ war a raxasu suñu loxo place boobu ñu samp ko fii samp ko yeneen barab tey nag ñu ñëw pour màggal bés ba nag dal di ko ubbi jox ko ñi nga xam ne ñoo ko war a yelloo xam nañ ne wér-gu-yaram nag du mun a am su fekkee ne nit ñi setuñu te set boobu luñ ko mun a defee nag mooy ne pour ñu raxasu suñ loxo yi mu set wéj na su ko defee nag kilifa yi nga xam ne ñoom laa liimoon fii ñoom yëpp yegsi nañ jël nañ seen toogu fi ñu toll nii léegi liñ fi mun a def daal mooy ne dañuy xaar suñ kañelang yi xaw ma fan lañ toll su ko defee ñoom ñoo ñuy ubbil li nga xam ne mooy daje bi tey te ñu am ab woy joo xam ne woy yéete la te woy xibaar la mi nga xam ne dinañu dalal suñu xel ñu xam ne lépp loo xam ne ñu ngi ko fi def nag ñoom it am nañ ci xam-xam te dinañ delluwaat ci loolu su ko defee nag am nañ xale yi nga xam ne ñoom it ñu jóge ko ci school daara bi nga xam ne moo fi nekk ñu xamee ko Mauritanie school ñoom it am nañ ay kaddu yoo xam ne dinañ ko fi gaaral pour su ko defee nag ñu jàngat ci li nga xam ne mooy wér gu yaram kon nag ñu bàyyi suñu kañelang yi ñu ñëw fi mu toll nii ñu ubbi bunta bi su ko defee ñu dugg ci mbir mi. I have the pleasure to call on Mr. Ablai Jaju, the Regional Health Director of North Bank Region East, to give his statement. Mr. Jaju.
The representative of the Ministry of Health, Mr. Lamin Ferreira, UNICEF representative, High Excellency Ambassador of the United States of America, the delegation of the USAID, the representative of the Governor of North Bank Region, the CEO of Forever General Hospital, the Director of Water Resources, the chiefs, alcalos, village support groups, and the committee members. Colleagues from the Ministry of Health, ladies and gentlemen, all protocol respectfully observed. Good afternoon. My task is simple, and I'm here to welcome you to the region. In fact, you are already welcome because Farafanye is a town of hospitality. Chairman, kindly allow me to quick round run down through the health demographic data of this region. The Health Regional Directorate covers 174 communities that stretches from Kerewan to Palogu, with a total population of 142,369, out of which 24,273 are under 5s. The region has 7 public health facilities, 6 community clinics, 2 private clinics, and 14 primary health care villages. Furthermore, every month we do conduct 52 RCH clinics, which of 15 are base clinics and 37 are outreach clinics. The region has one hospital that serves as a referral point to all other health facilities within the region and beyond, and that is Paraphernalia General Hospital. Chairman, in 2022, with support from UNICEF, the region was able to train 69 healthcare workers and 83 support staff on infection and prevention control. Also, UNICEF supported the capacity building of healthcare workers and village support groups on promoting key household behavior change. Great thanks to UNICEF. All our health facilities are equipped with wash supplies such as soap, detergents, and other sanitary materials, and 3 boreholes in this region. In June and July in 2022, the region had some other parts of the country experience heavy rainfall, which led to serious flood that affected 36 households in 4 communities. This has resulted in loss of lives, injuries, and collapse of many latrines, and eventually some water points. Because of this, our commitment towards ending open defecation in the region has been seriously affected. Chairman, let me thank UNICEF and other partners on behalf of my region for ensuring services are closer to the people through capacity building, community engagement, such as promotion of key household practices known as 4+4. Strengthening infection prevention control measures with provision of hand washing platform at strategic location where more than 100 people may utilize it a day, as this is the busiest health facility. As you can see, today is a base clinic, you see. So more than 100 beneficiaries you can see who are benefiting from this facility. As a region, through the engagement of our community structures, we are also promoting locally available hand washing structures to be installed at every household in the community called the Tipita. Thank you for all your attention, and you are welcome once again. Thank you very much.
So kumandi bi kanama be nyimbe ngoto jang ako kuma rabakela. Ako bari mbatu nga kumolu itandala dame yalon ko ntolumbe do kola dame wole mu kata sate membe jang atara fo sate keme sate taworo wula ani nani nyilu kono wole mu kerwan la alnyin tilbo ma fon la tintang. Ako fana itolu ning hade molu menu ka do ko ke nyin fannala wolube kanyana mo wuli keme wuli muang anin killing anin keme saba tangworo anin kononto ako fana ni ajube wol kono wuli keme fula tannani anin saba anin fula taworo worula anin saba wolu sio mantambe sanji lulula ako bari itolu ye dulal soto dame yalon ko wole munyin bode feloluti wolu tata fo dula worowula ye mennu yele jama kono anim fana ile do ku bundalu men tata fo woro wol be jama kono ana rayta ni fana ko men tata fo mofula ye wolu je memmu do ku dulalti nyim banko be kan ako fani ka minimini o ke damenu to kata pour que jata kende adi sate molla wotata kanyam fo tan anin nani nin sate ngol mono tarta jang ako bari fana karo kono e kata dulal menu to ata dulatal lulu anin fula dame ka moltare la sato fonto le kata ka jata kendia do koke o sato fonto je ako fana nata sabu yenindirike modu la men yala wuluka sabati wo dulal to o tata kanya fodula tan anin lulu anin fana ikata ka futa molu menuma atata kanya dulatan saba anin worwula nyin tundo kan ila do ko belarin tenne fana ako bari be tenturu nin jari kala UNICEF la kantun ye makoy bakele damen ya karandiro ke mo tan woro anin konon to la fo waniyata nyin do ko lu men yalon ko ibe wone ke kan do kundir lalla kata fo mo tan sey anin saba do ku ño ko tan lu men yalon ko yolu fanal nindi ka itandi ko ko fanal si sembo sotono ka makoy roke jata kende ala nyin tembenna ibla do ko be lorin wone ka ako bari ni nata juuɓe fana leptani jamala ɓe tundo kan bari leptani ba men yalon ko ɗolu nin kortan ɗo kolu mennu la wara jaralolu mennu la ke sammanan wo leptanol to ako mu leptani ba kelineti men tatta laƴol do jan bari ko kono e nataje ko fana mbe tembo men to ten koɗe a kuɓanata surtout ñinan ɗamme yalon ko sama jiyo siyata bakele ay tiñaro ke ɗulal to ɓugol tiñata moolu le tara dulal tiñata wonata korea ko saabu jom kongol men yalon ko moolu ka finti banda kata kene bato ka kene taki je ako nata korea saabu ma pour ka je bo danna ñamen ako bar nengal yakalamuta dula jamal le lota men yalon ko kawo dulalu dedale pour ka je ko jom ko no tamme moolu ka ke bantala e siwo bono ñamen bar bidum biriñin nat naka nata tiñar baake dame yalon bungol boyta kama jamalu boyta andu mo dolu fanalu dimindita kono e fote la balwol ni la fengol la ako mo kuleti mialon ko lafta kawo itande ako bari nyin bulu kudulade fenkum ma balemu e surtout to lañin tundo la jam ningal yaajube bimbe dame janten ali ba nyaabe bo bungo menna mennu nata kana nosla bi wolu jamale be je membita fo musolu mennu mu dimbaluti abita fo mo keme anim feng me yalon wol lebi kali na fala nyin na jang wati wati ni nga atra ko ina ta leftano to pour kana jata kende a nyinke ako to mbal be tan la mbal jayla alla lamor ko ni makam diringal nata jang wala mo regional director la komoti Mr. Jaaju ay men banque ni nasara kawal bokki Mr. Jaaju mo don wax mom moy kilifa gi nga xamne mom mo jité li nga xamne moy walu wégu yaram ci suñu tund ji nga xamne mom lañ fi nekkal tay li nga xamne mom la garal ci ay cadeau neena ñom jangal nañ ñi nga xamne dem nañ ci juroom fukki nit ak ñaar ci walu wégu yaram te ñoom suñ tollu nii seen liggéey bi nga xam ne moom la ñuy def ci tund gi loolu am nañ ci ab dimbal joo xam ne jëlee nañ ko fi nga xam ne mooy UNICEF pour ñu jàngal ñi nga xam ne ñoom ñoo war a liggéey ci wàllu wér-gu-yaram nee na nag ñooñu dinañ dal di liggéey ci suñu tund bi loolu dina yokk li nga xam ne mooy wàllu wér-gu-yaram naam lopitaan am na bi nga xam ne bu mag la bee na mi nga xam ne moo nekk ci suñu tund bi yeneen lopitaan yi nga xam ne ñoo ko dar nag ñoom dañ dee yónni nit ñi nga xam ne ñoom mënuñ leen a faj ñu indi leen foofu leen nee na nag jamono ji nga xam ne moom moo weesu fii nawet bi nag ren dem na ba nga xam ne ndox mi bëri na tax na ba béréb yu bëri yàqu nañ nit ñi seeni néeg yi loolu dem na ba fanweer ak juróom-benn ci borom néeg yi nga xam ne ñoom ñoo jàppale ak gaañu ak ñoom seen loolu tax na li nga xam ne moom la ñu ne bu kenn génn ci biti dem def génn tànk loolu tax na loolu mënuñ ko fee jeexal kon nag mu ngi gërëm waa UNICEF ci li nga xam ne moom lañ leen jàppandal muy liggéey ji nga xam ne moom la ñuy def ci tënd bi ci tenxal moom la fi gaaral ki nga xam ne mooy Abdoulaye Jaaju moom moo jiite wàllu wér-gu-yaram léegi ñu oo the students from Mauritania school to give their point
of the government. So my kids will come and say some of these important of the toilets.
I'm here to represent Farafanya Mauritania Lower Basic School. But before going further, I would like to introduce myself for the benefit of those who don't know me. My name is Abdusalamba from Farafanya Mauritania Lower Basic School. According to the world, nearly 1/3 of schools around the world still lack basic water, sanitation and hygiene services for gas appropriately. Wash facilities are especially important in ensuring their safe health. Participation in school and has been associated with improved girl attendance in at least 15 of 36 countries surveyed, and at least 10% of women and girls did not have a private place to wash and change at home. I'm thanking everyone.
di gërëm ñi fi ñoo teew ñëpp leen sant di gërëm waa UNICEF ñi nga xam ne ñoo taxaw si wàllu wér gi yaram si wér gi yaram xale yi ak wér gi yaram mag ñi ndax naka la ñoo mën a xamee wér gi yaram te du dañoo set naka la ñoo amee set te du dañoo defal ndox bi fu set waa UNICEF ñu ngi ñëw fii si noos bi ñu fi def fi ndox raxasukaay boo xam ne ku ñu war a ñëw noos ku ne boo ñëwee dangay taxaw nga raxasu bala ngay dugg si biir noos bi xale boo xam ne dafa war a xëy dem school bu demee school ba ñëw balaay lekk dañ koy defal ndox mu raxasu soo demee si dëkk yi nga xam ne ñu ngi si kaw gi itam dañoo am raxasukaay yoo xam ne ñu ngi ko def si kër gi foo munta dem boo ñëwee bala ngay dugg si kër gi dangay raxasu bala ngay dugg si waañ bi di togg dangay raxasu soo demee wanag ba ñëw dangay raxasu dafa mel ni set si la wér gi yaram dalee ndax boo amul sa wér gi yaram sax doo mun a jaamu yàlla dafa mel ni kon ñi nga xam ne ñoo taxaw si wàllu wér gi yaram ñu ngi leen di sant di leen gërëm parce que wér gi yarami xale mooy wér gi yarami mag te xale tey mooy nekk mag yi ëllëg kon ñu taxaw si xale yi seen wér gi yaram ba nga xam ne ëllëg day nekk mag boo xam ne mag bu xam seen liggéey la mag mën a liggéey addina bi la ñoo dox kon ñu ngi sant ñi nga xam ne ñu ngi fi teew yëpp mboolem koo xam ne jógee nga si dëkk bu mooy waa Farafeñe nuyu nañ ñëpp gërëm ñëpp sant ñëpp di gërëm ñi nga xam ne itam ñoo fi teew indi fi raxasukaay indi fi set setal yi nga xam ne moo ñu aar suñu wér gi yaram dem na ba si hôpital bi suñu jamono bu yàgg boo ñëwaan noos da nga daa am sa juróomi weer juróom benni weer doo dem noos léegi nag bala ngaa am ñetti weer si ngaa dem noos ma laa faj bu baax faj sa doom bi faj la ba nga xam ne boo amee doom doo am benn problème si biir bi nga amee doom bala ngay am fukki minute ak juróom taay bi nga amee doom dangay raxas sa ween bi ba mu set nga jox ko sa xale bi muy nàmp ba juróom benni weer doo ko jox ndox doo ko jox ñam mu lekk bu ko defee da ngaa gis ne xale boobu si laa mën a amee yaram bu baax waaye yaa ngi am doom rek balaa ñoo wax weer ñaari weer nga commencé la jox sa doom bi ndox muy naan buy waxee nga ne jox lekku naanu tam yaramam dina xam ne moom mu ngi lekk mu ngi naan parce que si yaramam lu mu laaj joxoo ko bu ko defee nag nga gis ne xale bi du am wér gi yaram wér gi yaram xale daal mu ngi dalee si xale bi na set na am nampal bu doy mu ngi dalee si nga am namp juróom benni weer lekkuloo naanuloo boobu si la nampal bu ma dalee ñu ngi leen di sant nag di leen gërëm di leen ñaanal yàlla programme bi yal na ko yàlla yóbbu sa kanam wét gi ñu bëgg si réew mi yal na ko fi yàlla def bi jaay Nabil Moustapha.
Of UNICEF here in the Gambia. Let me acknowledge the presence here today of the representative of the Minister of Health. I can also acknowledge the presence of our very dear friend, Excellency, the Ambassador of the United States of America to the Gambia. Also of the office of the Governor. I would also like to acknowledge the Regional Health Director. All of the alcaldes present here today. I'd like to also make a very special recognition to the women leaders of the community who shared their perspectives with us here today. I'm strongly convinced that women leadership is fundamental and it is essential to guarantee and safeguard not only the health of our children, but the health of our communities and the health of our nation as well. During the COVID-19 vaccination campaign, we noticed that for every one man vaccinated against COVID, there were approximately 2 women vaccinated against COVID. This is an indication that you know what is best for the communities. You know what is best for your societies. And I'd like to take advantage of the fact that I'm here at the podium to now encourage the women of the Gambia to also mobilize your communities to get your children vaccinated against measles. This is a very dangerous disease that can cause death in children. And it is a very important effort that we're undertaking now with the Ministry of Health to ensure that all children under the age of 5 years are also vaccinated against measles. So the same leadership, women of the Gambia, that you demonstrated to encourage people to get vaccinated against COVID, we want to see the same energy and the same motivation to get your children vaccinated against measles. So please spread the word. For me, as representative of UNICEF, it really is a tremendous honor to be here today to hand over the hand washing stations to the Ministry of Health and the Department of Water Resources. In total, thanks to the very generous funding provided by the United States Agency for International Development, we have been able to construct a total of 22 permanent hand washing stations, each of which contains, or each of which has, a total of 6 hand washing taps. These are being distributed, built 5 in the Upper River region, 5 in the Central River region, 5 in the Lower River region, 2 in North Bank West region, 3 in North Bank East region, and 2 in West Coast 2 region. All of them are fully functional as we speak, and they will provide safe and clean hand washing water. Additionally, the USAID funding has been instrumental for us to procure for use in these hand washing stations of 600 buckets with mops, 350 garbage bins, and 2,170 buckets with taps. And another critical milestone with this project has been the provision of a backup solar-powered system, water system, with a tank capacity of 10,000 liters to 6 health facilities across the country. So I would like to express, Madam Ambassador, our deep gratitude and satisfaction to the people and government of the United States of America for this support. It's going a very long way to guarantee safe water for the people of the Gambia, and at the same time contribute to the elimination of the spread of COVID-19, allowing people that social practice which is so important. Hand washing is fundamental to limiting the spread of COVID-19, and let me remind you that COVID-19 is still in the country. The pandemic is not over, even though many of us are fully vaccinated, even though many of us are able to engage now because of the protection of COVID-19. And the support of USAID has also been instrumental to support COVID-19 vaccination campaigns. And the last round of COVID-19 vaccination, supported by USAID, has been instrumental to raise the coverage from approximately 14% to 18% total vaccinated individuals as a percentage of the total population. We're not out of the woods yet. We still have a lot of work to do. If you haven't been vaccinated, consider very strongly getting vaccinated. If you know people in your family who have not been vaccinated, please encourage them to get vaccinated. So what the COVID-19 pandemic has shown us is that in emergency situations, water, sanitation and hygiene, nutrition and public health interventions such as vaccination play a crucial role in mitigating the impact on you, the communities, you, the women, you, the children, and all other members of society. Since the outbreak of the pandemic, we've been working extremely closely as part of the United Nations team with the Ministry of Health to ensure that all of these safe and effective interventions are made available to the public and to the entire country. Let me then stop here just to say how important it is to look at everything in an integrated manner. So it's not just about getting vaccinated, it's not just about safe hand washing, it's not just about spreading the word. All of those efforts need to be done in an integrated manner in order to reach farther, in order to reach more people here in the country. So to conclude, once again, our deep appreciation to the United States Agency for International Development. Went very far with this support. Today is only one example of the very many things that we have been able to achieve with this particular funding. Let me also acknowledge the tremendous leadership at the regional level of different government authorities under the leadership of the regional health director. And finally, let me just say that as long as we have public health challenges that may affect the health of the communities, we will be here together with you, working side by side, hand by hand. And I know I can say the same for our dear colleagues at the U.S. Embassy. And a tremendous shout out to all of my colleagues from the UNICEF office who are here on a daily basis, monitoring the work, ensuring that it's done with quality, ensuring that there is value for money and that everything is done in the most efficient way possible. So with that, really look forward to cutting the ribbons, washing our hands, just to demonstrate that it is in fact functional, that it works, and that it is effective. So thank you very much for having us here today. Celebration.
Good afternoon. I am Sharon Cromer, the U.S. Ambassador to the Gambia. And I'm here in Farafeni on behalf of the U.S. government and our premier development agency, USAID. I want to thank you for the invitation, and I want to recognize the Ministry of Health representatives here, the Governor's Office, the Regional Health Director of North Bank East, UNICEF representative and the entire staff, beneficiaries, although I do not like using that word, beneficiaries, because what I see here are actors. People who are dedicated to their own development and well-being. And of course, the media.
Yes, sir. Thank you. We are part of.
Today we commission hand washing stations in 22 high-risk communities across the country. These stations will reach approximately 264,000 people, 10% of the population. Why is that so important? Following the onset of COVID-19, hand washing and other hygiene practices received unprecedented attention. Hand washing with soap and running water is critical to limit the spread of the virus. This simple act is reported to lower the risk of transmission by 36%. Hand washing also prevents the spread of other infections, including acute respiratory disease, cholera, and hepatitis. When we wash our hands with soap and running water, babies stay healthier. Children go to school. Adults go to work, and communities thrive. Hand washing may seem like a very simple task, but for some households and health facilities and public spaces, it is a luxury. Therefore, the U.S. government, through USAID, is honored to be a part of this effort and provide hand washing stations, and also assist in 7 health facilities with uninterrupted water supplies via new backup systems. The installation of these facilities will be supported by a public awareness campaign on infection prevention and control of COVID-19. We want everyone to hear the message that hand washing saves lives. Today's hand washing is part of the U.S. government's continuing effort to prevent illness in the Gambia and around the world. Since the start of the pandemic, the United States has led the global fight against COVID-19. To date, the United States has responded in more than 120 countries with over $9 billion in funding toward the fight against COVID-19. Here in the Gambia, we recently provided $500,000 in supplies to help the Ministry of Health to respond to COVID-19 and other health emergencies. This was part of a broader $2 million project funded by the United States to help the Gambia with vaccines, communication efforts, community engagement, sanitation, and access to safe water. We also donated more than 440,000 doses of COVID-19 vaccines to the Gambia through the COVAX program. Safe and effective vaccines are proven to be a highly effective tool to end the pandemic, and we are proud to have played a role in keeping Gambians protected. Additionally, to address COVID-19 and many other health and safety issues, the U.S. Peace Corps volunteers are working with health providers throughout the Gambia's rural communities. I will visit our volunteers at their training site today and will let them know how much their work is appreciated. These efforts, along with several other assistance programs, are part of the U.S. government's continuing support to the Gambian people. A stronger Gambia can build a better future for all. I wish you and your families the best of health. I would like at this time to make one more statement on a different topic, but it's not so unrelated. This morning, the Gambian government announced that the government and the U.S. Embassy signed a memorandum of agreement to begin the due diligence process to purchase and develop a site for a new U.S. Embassy in this beautiful country. The proposed site is the land currently occupied by the West Africa Livestock Innovation Center, WALIC, on the Bertil-Harding Highway. In recognition of our long-standing and growing partnership with the Gambia, a new U.S. Embassy will enable us to accommodate new initiatives, like new initiatives and projects from USAID and other U.S. government entities to support the Gambian people. We look forward to beginning this planning process with the government, along with civil society, environmental stewardship groups, and others. The new embassy will be built to strict U.S. building codes and standards. Consistent with the U.S. government's long-term global commitment to environmental diplomacy, the new embassy will be a high-performance green building, the first of its kind in the Gambia. The new embassy will not touch the Bigelow Forest Park. We will be a good neighbor and a good steward of the park. We will enhance the park in its role in environmental education and forest protections for today and generations to come. I'm thrilled that we will begin this process, which represents an opportunity for the U.S. government to invest more in the Gambia. This project will create hundreds of jobs for Gambians. We will train skilled laborers. We will use Gambian technical experts. This will create domestic and international investment in this country. So I am proud to make this statement today. Thank you.
U.S. Ambassador to the Gambia, Sharon Kroma, UNICEF representative, Jonathan Lewis, the representative of the governor present here, the regional director of health services, North Bank region, staff of Minister of Health present here, UNICEF colleagues present here, media, the Alcalo of Farafenye, the chief, ladies and gentlemen. Before I start the speech of the Honorable Minister, I'd first like to extend the greetings of Honorable Minister to you, who really want to be here, but due to circumstances beyond his control, he has not able to be here presently, physically, but spiritually, he is with us. So I will read his statement, then the statements read. Today marks a crucial milestone in the long-standing, genuine partnership between Ministry of Health, UNICEF, and USAID, and I stand here to thank USAID through UNICEF for their relentless partnership and support to the government of the Gambia, particularly Ministry of Health. Barely a month ago, this is the Honorable Minister speaking, I presided over a similar gathering where USAID through UNICEF has presented medical supplies to Ministry of Health to equip in our efforts to fight COVID-19. And today we are here again to inaugurate the opening of 22 hand washing platforms which are constructed all over the country. The very presence of the eminent individuals assembled here this afternoon has clearly demonstrated the absolute importance of this event. The government of the Gambia recognizes that safe water, improved sanitation, and hygiene are essential in the improvement to the people's health and development, and in contributing to the attainment of the targets under Sustainable Development Goal, particularly 6.2.1. Proportion of population with hand washing facilities with soap, water available on premises. The SDG targets relating to sanitation are much more ambitious, and through its sanitation and hygiene are also considered as major determinants of poverty. While improvements to sanitation and hygiene not only generates economic benefits in terms of better health and more productive pursuits of higher productivity, but it could also produce positive outcomes for school enrollment, retention and performance, as well as a healthy and dignified living environment. It is clear without doubt that sanitation and hygiene is one of the most fundamental values of human life, dignity and development. Poor sanitation and hygiene conditions are a contributing and leading factors to diarrheal diseases and environmental pollutions, with a complex reciprocal link to malnutrition in children. the importance of adequate access to sanitation and hygiene facilities as a driver for social and economic development, poverty reduction, and public health advancement is fully acknowledged in the country's flagship policy development documents and national development goals. Due to the importance attached to sanitation and hygiene, His Excellency Adama Barrow's government has committed itself to reaching very ambitious targets in sanitation, among them the targets to increase the proportion of the population with access to improved sanitation facilities from 64.9% to 75%, as well as increase the proportion of households with a place for hand washing with soap and water from 33.3% to 60% in urban areas and 26 to 50% in the rural areas. And also to make Gambia open defecation free from 99% to 100%. So partnership like this will accelerate the government's effort to achieve these targets within a short space of time. The COVID-19 support project to the Ministry of Health from USAID through our valuable partners UNICEF has provided the following important interventions in the area of water, sanitation, and hygiene. One is to support the implementation of hand washing promotion campaign in CRR, where 669 communities were reached, 16,370 people were reached, out of which 10,291 are female. And the project was able to support Ministry of Health to train 170 health workers, including support staff, in 76 health facilities, were trained on infection prevention control for COVID-19 and other diseases. It also helped us to have national IPC guideline and standards, which has been developed and disseminated all over the country. And today we are here to inaugurate 22 hand washing facilities, which has been completed. They have been constructed and completed all over the country. And also a solar-powered water systems has been completed in 7 health facilities throughout the country. In each, we are provided with 10,000 liters water tank. These interventions will go a long way in our not only improving the health of the population, but contribute to the socio-economic development of the country. On behalf of the government of the Gambia and His Excellency Adama Barrow, the President of the Gambia, I want to thank USAID and the people of America through UNICEF for the support and hoping for a stronger partnership and collaboration. As you can see, the women attending the antenatal clinic here, children, health workers, both at the regional and also at the health facility, are utilizing this hand washing facility or station, particularly during clinic days when the number of healthcare seekers are highly too much in the area. I have been reliably informed that the hand washing stations that were also constructed in all health facilities all over the country are fully functional and people are utilizing them. I will also assure you, UNICEF and the USAID, that these facilities will be maintained and utilized. On behalf of the Honorable Minister, we would like to thank you all for the support and also hoping for a stronger partnership and collaboration. Thank you.
By acknowledging the precedence of the meeting, covering such an important event. and taken messages to the community regarding the fact that we still have COVID-19 in the country. As you know, hand washing is one of the most effective ways of preventing the spread of COVID-19. And during the height of the pandemic last year, the Ministry of Health, together with UNICEF, reached out to the United States Agency for International Development, which was extremely generous in providing a grant of approximately $2 million United States dollars to support two components: increasing vaccination coverage against COVID-19, and the other component has to do with social mobilization, risk communication, community engagement, and water, sanitation, and hygiene. Part of the intervention is to construct 22 permanent hand washing stations throughout the country. Today, we're here at the Farafeni Regional Health Directorate to do the symbolic handing over of these 22 hand washing stations to the Ministry of Health, to the people of the Gambia, to the government of the Gambia. We were accompanied by Her Excellency, the Ambassador of the United States of America to the Gambia. We're here. We're also with members of the Office of the Governor, the direct representatives as well of the Ministry of Health. So the key messages are: hand washing is an extremely safe and convenient measure to curtail the prevention, the spread of COVID-19, as well as other cross-infections such as cholera, such as diarrheal illnesses, and so on. So that's why we're here today.
Okay, as you mentioned, your target was to get 22 standing stations, and among these 7 regions. What are we expecting from you? Are we expecting more of such?
Well, at the moment, we've also built 7 backup water supply systems, solar powered, with 10,000-liter water tanks. And these are in 7 health facilities across the country. But between now and the middle of next year, with the generous support of USAID, we're also going to support more vaccination campaigns, because we have to increase the proportion and the percentage of individuals in the country who are fully vaccinated against COVID-19. We're going to continue with the social mobilization, with the community engagement, with training of women and youth leaders who, at the community level, are mobilizing communities to uptake vaccine availability, and also to ensure the communities are well aware that these hand washing stations are in the health facilities, so that they can continue good practices of hand washing and prevention of the spread of COVID-19.
As we understand, though the ones you hand over this thing are to take care of it, though, what is your advice to the ones you hand over in case of taking care of these things?
Well, you know, the Regional Health Directorate is fully responsible for the upkeep and for the maintenance of these hand washing stations. We already have an agreement with them that they will, in fact, honor that commitment. They are responsible for the upkeep in the same way that they are responsible for all of the other infrastructures that is a part of the Regional Health Directorate. So it's important for us to underscore this is not a UNICEF facility. This facility belongs to the Regional Health Directorate and to the people of the Gambia.
Thank you very much.
Thank you very much. The communities are identified together with the Ministry of Health. They identify those communities or those health directorates where such facilities are not currently available. So at the moment we have 22 of these hand washing stations in different health directorates in each of the regions of the country. So it's not UNICEF that identifies where they will be built. It's rather the result of a conversation and an analysis together with the Ministry of Health and the Regional Health Directorates. The issue of acute kidney injury, well, obviously this is an issue of tremendous concern to not just of the government, but of the people of the Gambia.
We at UNICEF, together with other agencies, specialized agencies like the World Health Organization, are providing guidance and technical assistance to the Ministry of Health in terms of developing protocols, and we have been actively involved providing logistical and technical support in the recall exercise of the paracetamol syrup that, as you know, has been identified and needed to be recalled. Obviously, one of the key messages that we're transmitting, especially to parents and especially mothers who are the principal caregivers of their young children, they need to be watchful and mindful of certain symptoms that should alert them to take their children immediately to the nearest health authorities and to suspend immediately the use and the administration of that particular paracetamol syrup to their children.